When the Affordable Care Act became law 4 years ago, people like Monica Barnes were the target. Barnes has never had health insurance until now.
Without insurance, it's been a very rough thing because each visit I make, I had to pay in the full amount. And if I have any emergency or anything, I have to pay for my visits.
On Monday, the enrollment deadline for Obamacare, many like Barnes flocked to New York City's Bellevue Hospital looking for last-minute help.
What does this one ask for?
This is the business name.
The surge in interest has prompted Bellevue Administrator Tony Morton to keep financial counselors on standby in the lobby.
The startup was a little slow, but once March came in, we were off and running.
The weekend saw a wave of activity across the U.S., like this enrollment drive in California and this telethon in Texas. As the March 31st deadline passes, the debate has shifted from how many people are enrolling to who has enrolled. Young Americans are widely seen as key to keeping the new online marketplaces viable for insurers. SEIU President Mary Kay Henry says the signs look promising.
We expected that young people would tune in the final weeks of the enrollment period, and that's exactly what's happened. There's been a huge surge.
Conservatives maintain the law won't insure as many of the nearly 50 million previously uninsured Americans as the Obama administration had promised. Paul Howard of the Manhattan Institute says the cost of health care may still be prohibitively high for some.
The biggest problem that I think we're going to be wondering about for the next year or two is what is going to happen to rates in 2015 and then beyond. So really, insurers only had 3 months worth of claims data to start putting together their rates for 2015. They have to submit that in May and June. They're not going to see a full year of rates until they're going into their 2016 premium period.
And so despite the deadline, a final verdict on Obamacare could still be years away.